We're speaking today with Kentucky Governor Andy Beshear, a Democrat and 63rd governor of the Commonwealth. He previously served as Kentucky's Attorney General.
Governor Beshear has fought for the protection of the Affordable Care Act and for Medicaid expansion. He's been issuing broad public health directives to stem the spread of COVID-19 in his state, and that's led to some legal challenges. Governor Beshear, welcome to Conversations on Healthcare today.
Thank you for having me.
Yeah, Governor, the resurgence of COVID-19 is really causing havoc all across the country, but particularly in the South, where many of the governors have aggressively sought to limit public health measures, like mask wearing, for instance. But in fact, in your state, the state Supreme Court just upheld a challenge by the Kentucky legislature, which sought to limit your executive powers in response to the pandemic. And it is hard to believe that the judge used the word tyranny to describe your mask mandate for K through 12 school children. How's the court's decision impacting your overriding objective to keep the population of Kentucky safe?
Well, it seems these days that name calling is not confined to just some, and tyranny now means I disagree with you. Listen, from the very start of this, I was committed to doing the right thing, to following the science, because at the end of the day, I care about the lives of my people a lot more than I care about my own personal popularity. And so along the way, I've had to make difficult decisions. It's everything from when we had to be healthy at home to when we previously had a mask mandate in Kentucky, to my decision to require it in universal masking in public and private schools here as we went back in the Commonwealth. I did those knowing that there would be backlash, but having the courage to just do the right thing and knowing what it is. And in these instances, it's not just right versus wrong and life versus death. It's what works and what doesn't. If you have universal masking when a class goes back, you can stay in person. If you do not wear masks, you end up with everybody in quarantine. So I was willing to do the right thing and to push forward, even with the criticism out there. Now, the Supreme Court recently came out and said, I'm not going to be able to carry the ball fully anymore. That these tough decisions, instead of being made by one individual, that has a little more latitude to do the unpopular thing, if it's the right thing, they're going to be made by a legislature consisting of over 100 people. It may be harder for them. And that legislature has suggested before that they don't agree with mask mandates, but I'm certainly going to push and do my best to provide the education to show them that that is the only way right now. Because as we're talking, I just got news that we have the third highest number of cases in Kentucky than we have had at any time in the pandemic. And that's with over 60% of adults in Kentucky having at least one shot of a vaccine. And today, we announced 65 deaths. We were down to 3 a day. I was looking forward to zeros, numerous days in a row, which I hadn't yet had the opportunity to see. So our state and the South, what'll be the entire United States, is on fire with the Delta variant. Now more than ever, we've got to make the right decisions guided by public health to save lives. And I'll also say, and we can talk about it, our hospitals are bursting at the seams. Yeah. We have one that has a disaster plan in effect, the disaster plan. People are being treated in their cars outside of them. So we're calling in the National Guard to help. We're trying to take over testing for some of them to free up staff. And we've asked FEMA for help. So this is a time when we need strong leadership, and I hope the legislature will step up and make the right decisions.
Well, Governor Beshear, we are sorry to hear this. It's, of course, exactly what we're reading. The numbers don't lie. And while we can talk about the fact that much of this was preventable, if we could have gotten out there sooner, getting people to be fully vaccinated, yes. The reality is you have to deal with what you have on the ground right now. Tell us more about the impact of this Delta surge on your state. How is it affecting life in your state? And maybe share with us a little more about the hospital situation. You've got hospitals and health centers, clinics all over the state. How is it affecting the whole healthcare system in your state?
It's dire. And when they say this thing is aggressive, that's not a good enough word for it. It's like an inferno. How quickly it escalates. Cases going from in April or in early June in the hundreds to, I think we have 4,800 new cases today. More kids than ever before. Used to be about 11% of our cases were kids. It's now 20+%. Remember, little kids don't get tested that often. It's making people sicker from the very beginning, and we're losing younger people in their 30s and 40s without pre-existing conditions. We're seeing more breakthrough cases, primarily with those that'll be helped by the booster that the immunocompromised can already get. But its impact on hospitals, especially hospitals in areas with lower vaccination rates, can't be understated. Most of these hospitals, aren't used to helping higher acuity, sicker patients. Most of them don't have that many ICU beds, and almost none of these hospitals have pediatric ICU beds. And so we see the ICUs filled up. We see the COVID wings filled up. We see operating rooms being turned into additional COVID wings. And we see our healthcare heroes so tired. St. Clair and Moorhead is in their disaster mode where they can't take any more emergencies, and the ambulances are pretty much running people to other hospitals. Pikeville Medical Center has a triage tent outside of the ER to push some to other places who might not need emergency care. Ephraim McDowell, which is a hospital where people don't die in this hospital because they're transferred to higher level trauma hospitals, had 7 pass away over the weekend. Their morgue only fits 2. And so we saw refrigerator trucks. And I declared this week Healthcare Heroes Appreciation Week because they are so tired and they've gone through so much trauma and they're rightfully frustrated. And we've got to keep our healthcare staffing up at a time when so many are saying I've already fought for too long. So this Delta variant, which you're right, was entirely preventable if people would have gotten vaccinated. And if they would have stepped up to protect their brothers and sisters and families, it's having a major toll on Kentucky, and it's going to have a major toll on the entire country. Because what we're learning is you can have a lot of your population vaccinated, but with this Delta variant, you got to get close to all of them vaccinated.
Governor, the kids are going back to school now without vaccinations, without masks, so virtually no protection against the virus, leading to, as you said, massive quarantines. And I believe you liken this scenario to throwing a giant chicken pox party, only with the 3rd deadliest illness in the country. I wonder if you could talk a little more about the dangers you see for the state's children, their families, the teachers, but also some of the strategies that you're doing, having to work around the General Assembly, because I know your administration is trying to educate and reach into all the neighborhoods of Kentucky.
Well, this one's real personal to me. I'm the dad of 2 middle school children. One is 12, Will is fully vaccinated. I broke down in tears when he could get his first and his second shot. But my daughter, his sister, is a year younger, is 11, and she can't get vaccinated yet. Thankfully, they go to a school that chose universal masking. And then I stepped up and required it because we had one school district, Warren County Public Schools, that went back mask optional. They were one of the first. And in 3 days had over 700 kids in quarantine. That rose to 1,500 kids in quarantine. When I put in universal masking, and they've been there since, that has been cut in half and is going down. So listen, one works. Universal masking, that newest study that came out, cutting transmission by 80%. One does not. Every school district anywhere with unvaccinated kids in poorly ventilated classrooms for hours at a time, you're right, is like a giant chickenpox party with the 3rd leading cause of death in America. I mean, come on. We can't be allowing that to happen to our kids. And keeping our kids safe isn't some issue of personal liberty. Come on. Our kids aren't our property. They are not an opportunity for us to have our political arguments. They are a solemn obligation. And right now we require what? We mandate 12+ vaccines by the time you're in 6th grade, 30+ shots that are out there. And all we're asking them to do is wear a piece of cloth over their face that helps prevent the spray, and the spread. It was every education group that supported the mandate I put into schools. It was the leader of the Kentucky Superintendent Association. It was our Kentucky Chamber of Commerce, which hadn't always been with me in the steps I've had to take, because they are certain, and it's a fact, that if a ton of kids are quarantined, which they will be, mask optional, a ton of parents can't go to work. That's lesser productivity and has a direct hit on the economy. So right now, we still have, at least in public schools, the mandate in place because our Board of Education courageously and unanimously passed an emergency regulation as well. But private schools and maybe in the future public schools won't have that mandate in effect. So what I'm doing is I'm trying to talk to every superintendent, anybody that'll listen to me about, again, you might have a couple parents that are upset with you now, but when their kids are quarantined or testing positive, they're going to be a whole lot more angry. And with more kids suffering long-term consequences, I hope people don't say, well, you only have 21 kids in the pediatric ICU. First, that's more than we've ever had. And second, we got kids in adult ICU that we don't have in that count because we only have 2 pediatric ICU units in the entire state. This ought to be a no-brainer. And if I sound a little frustrated about it, I am, because my kids are the most important thing in my life, and they ought to be for everybody else.
Mm-hmm.
Well, Governor, we totally appreciate your frustration, and we'll be talking about this one for a long time, years to come, trying to understand how something like immunizations went from being a very small minority of people who opposed them to where we are today. But,
Amen.
you know, along the way, we had heard an awful lot as we conducted vaccine campaigns. One of the arguments people put out was, well, this wasn't a fully approved or authorized vaccine. It was still, you know, emergency use, kind of in the experimental phase. But that argument is over now too, right?
Right.
There's been the full authorization, full approval of the vaccines. Do you think this is actually going to make a difference in vaccine uptake in your state? And what other strategies are you and your team deploying to try and increase that vaccination rate? We've been cheered by the numbers have been going up around the country. I think in the past week, that was the highest week that we've seen since back last spring. But what else are you doing to try and get people to change their minds and get vaccinated?
Well, full FDA approval should move a lot of people, because you hear a lot of people say it. And now we're going to figure out if that's the real reason.
Yeah.
No, I think in general, we have 2 groups of people left that are unvaccinated. You have those that have been provided misinformation, but believe it on a couple of topics that if we could get the right information from someone they trust, but that could just be a friend, perhaps. It might be that a doctor can't even get through, that they'll get vaccinated. And then you have some that are just politically opposed to it and short of being ventilated themselves, at which time they will beg for the vaccine, don't appear that they will get it. So for the groups that that misinformation does appear to have created skepticism, but maybe not locked them off, I think this concept that it was rushed ought to now be settled. Full FDA approval is a gold standard. It's what the smallpox vaccine and chickenpox vaccine and polio vaccine, all of which we've taken, and we're still here, received. But the other thing I'd say is half the country has taken this vaccine. At least 1 out of every 2 people that you'll come across has taken this vaccine. So if there's a problem with it, we'd know it by now. I think the other 2 myths we got to directly debunk are that can make you sterile. Entirely not true, but we've even had Kentucky leaders that have been telling people that falsely, as well as a concept that if you're pregnant or you want to become pregnant, you shouldn't take it. The CDC's directly addressed that, saying it's much more dangerous to be unvaccinated and pregnant than vaccinated. Now, we're still looking for any strategy to get people vaccinated. And really across the country, I think it's rightful fear of the Delta variant that's truly driving it.
Yeah.
Here in Kentucky, we have a lottery. We've made 2 millionaires. I get to make another one on Friday. We're giving away full ride scholarships to kids. I can't imagine a better thing for us to do to encourage people to get vaccinated, but just a great thing to do in general. I get to give my next 5 out, so I feel like Willy Wonka. This is the 3rd set of 5 kids that get their golden ticket.
Wow.
We've got our MCOs, our managed care organizations with Medicaid, offering money. We're still not seeing a lot of people come around to that. So we're learning a lot about incentives right now.
Yeah.
I think what we're really going to see now we have full FDA approval is company, private sector mandates, because this is their workforce, and their workforce could be wiped out very quickly. Look at Tyson, Tyson Chicken. You got their huge operations, and COVID can spread and ravage a facility there. I remember because we had to shut one down for a couple of days. That's a workforce that if you want to protect it and remain productive, that vaccine is really necessary. I see that as the next big step that's gonna boost numbers.
I think you're absolutely right. We're speaking today with Kentucky Governor Andy Beshear. Governor, your father, former Governor Stephen Beshear, joined us in 2013, and he spoke eloquently about the reasons for the Affordable Care Act and the Medicaid expansion, a rare position amongst Southern governors. And your predecessor, though, tried to dismantle much of those gains and sought to really, and you've really tried to correct that course. And I remember your father telling us that the ACA was not only good health policy for Kentucky, but it was good economic policy. And the same logic could really apply to vaccines. And I think you've said that one hospitalization could cost hundreds of thousands of dollars. And I'm wondering, as governor, you have to think about these things. Help our listeners understand the economics of prevention and public health measures and why vaccines are truly the best hedge against both health and economic calamity.
Well, first, let me say Steve Beshear is a great man, a great dad, was a phenomenal governor. And him embracing the Affordable Care Act and expanded Medicaid is one of the reasons that Kentucky, a state that was predicted to have one of the highest per capita death rates in this pandemic, has not, because access to health care is the difference between life and death. And expanded Medicaid is absolutely necessary to expand access. And let me say, I was honored to fight for that program. My dad instituted the Affordable Care Act as governor, and as Attorney General, I was the co-lead with Javier Becerra in fighting to protect it. And the biggest legal victory of my life will be that ultimate Supreme Court decision that in part bears my name in the Commonwealth that preserved that legacy. So many different things, coverage for pre-existing conditions, expanded Medicaid, you name it. And for to be able to protect a little bit, not just of how incredible it is, but my father's legacy is something that I will forever be grateful for. Any state that hasn't expanded Medicaid absolutely needs to. And I will say during this pandemic, we had to take additional steps. Before the pandemic, I rescinded the Medicaid waivers that my predecessor had done that would have kicked 100,000 people off their health care. But we were at a point last summer where African-American Kentuckians were dying at twice the rate that they make up of our population. The reason was access to health care. And so we led a specific marketing campaign directly to that in our Hispanic population to get folks signed up. And guess what? Being intentional works. Sure, a lot of people tried to say free healthcare for one group or the other. Listen, it was available for everybody. But now our death rates line up with or are below our population numbers. Being intentional works. Now I know the second part of your question was about the economics of this. And eventually, I think our insurers and others are going to come around and you're going to see some major movement there. To get your shot of hope, to get your vaccine, costs you $0. Federal government is paying for it in general, and typically it costs your insurer, your employer, $0. And what that does is give you really a 90+% chance of never being in the hospital and of not dying of COVID, an even better chance there. Now, if you are unvaccinated and you end up in the hospital, your bill is likely going to get close to $100,000, if not 30, 60, 90. And if you end up intubated, oh my goodness. So your decision to not get vaccinated causes huge costs to everyone's insurance plans, to your employers, will ultimately drive everybody's costs up. Now, there's going to be a point where these insurance plans, just like if you're a smoker, you currently have different costs, are going to say, if you refuse to get vaccinated, we can't carry that huge bill. So I think that's going to be another mover that you're going to see. But let's bring it down to a human level. If you're unvaccinated and you end up taking up a hospital bed, and our hospitals are bursting at the seams, and we have an accident with a bus of school children, a bus of adults, and there aren't beds for them, more of those people die. That's it. More of them die. Yeah. It shouldn't. Your friend who has a heart attack dies and shouldn't, because of a choice to not get vaccinated that lands you in the hospital when that bed would otherwise be open. There is an economic cost, but there is a huge personal cost too, where your decision could take somebody else's life and not just from COVID.
Well, Governor, all compelling stories and observations, and this idea of there simply not being enough beds is very real in your state and around the country. I think what we've also seen is there may be beds and there may simply not be enough ICU nurses and intensivists to staff those beds. And we've talked about some of the reasons, the exhaustion from, a solid, 20 plus months of this. I wonder, and I really appreciate your designation of the Healthcare Heroes Week, and I'm sure all the healthcare workers in your state appreciate it. What other strategies are you looking at in terms of keeping a workforce in place to be able to manage this? It's not going to go away soon. The people that are there today may not be able to carry this burden indefinitely into the future. Are you looking at training other kinds of workers? Are you bringing in healthcare professionals from around the country? What are your university and academic medical centers and other groups doing to try and help you meet the incredible needs, so that where there's a bed, there's also a well-prepared ICU nurse or intensivist to take care of people?
Well, you're right, and it's probably not going away in the immediate term, but I really think it's important that everybody hears that we could defeat this thing tomorrow, simply by going to your drugstore, your grocery store, your local health department, and getting vaccinated. And if everybody got vaccinated tomorrow, we could substantially end this whole thing. It's right there in front of us. And the ability for us to win. In Kentucky, this has taken more lives than any 2 or now I think 3 wars that we have been through put together. Think about that. If you were in the midst of a war and you could win tomorrow, right? You'd just by going to your drugstore, you would do it. So you're 1,000% right in that it's not actual beds. It's our ability to staff it. And so we're trying to do a couple things. Yes, first, we're trying to show our appreciation and give a second win to the warriors on the front line. We're also trying to amplify them. We're sending National Guard strike teams to the hardest hit hospitals to try to take over any non-medical function that we can free up more people to staff beds and help people out. We've requested help from FEMA, and they're going to bring in more ambulance units because we're running short on our ability to help in emergencies because of the transfer of patients. We've asked for nurse strike teams, but we get that this is happening in so many other states. Right now, we're working on a way where we can move in and take over the testing that all these hospitals do, because that frees up more people to ultimately help out. I want to make sure the number one thing we can do to preserve healthcare capacity is get vaccinated. Number 2 is to wear a mask.
We're speaking today with Kentucky Governor Andy Beshear. You can learn more about his leadership and his efforts to address the pandemic in his state by going to covid19.ky.gov. You can also follow him on Twitter at GovAndyBeshear. Governor, thank you so much for the example you're setting, the courage of your convictions, for your efforts to ensure that all of your state residents have health coverage, and for taking the time for joining us on Conversations on Healthcare.
Well, thank you. And we always end our updates with a simple phrase. We will get through this, and we will get through this together. Now, everybody go get vaccinated.
Everybody go get vaccinated.
Hear, hear.